one of the reasons that you would want to go this route as to some other route to doing evidence-based practice is that you are actually involving your stakeholders, the people who are going to actually have to do the innovation that you've developed, the evidence-based practice. You really are engaging with them from the beginning. I know that in the Partnering for Change project, the process they used, and this was before sort of I came in to the project, but I think it worked very well, is they started with a core issue that was a problem in the system of how you provide occupational therapy supports to children with disabilities in the school system. And they identified, there was a very core group of maybe 3 or 4 people who were really invested in trying to change the system to do a better job of supporting these kids. And so it started with getting a small pot of funding to have a stakeholder engagement day. And the central question was really around bringing people together who had an interest in this particular population of children and servicing them better. Some families were invited, some educators, some health professionals, and some people from the health service system. And it started at a small level with the question of what would success look like if we were to think of a future, if we were to envision what is it we want these children to have, what would the elements be, what do we think we would want, what do we think the outcomes would look like, how we would want to support these kids. And that gave sort of a very broad overview of what people wanted to see. And I think people, yes, you can have contradictory views, but I think when it came to what is it that would serve to help the children, people actually get on the same page in terms of if we put away all the constraints of funding and system constraints and competing priorities, and we just talk about what do we want for the kids, people then had a similar vision and passion. So from that meeting, the team applied for a small research grant where they had a unique situation where they had 2 occupational therapists who would be called, I would call them clinician scientists. They were still very much actively engaged in clinical practice, but they also had roles on faculty, and they had a very good understanding of research and of the vision that the team had. And so they literally went out and said, we're going to go out and in 2 schools, one day a week, an OT is going to go to each of these schools and work with some educators to try some things out. They didn't go in with, this is a curriculum we're doing, or this is a exact intervention. So it was very open-ended, and their job was simply to go out and say, if we were to go into schools and embed an OT into schools and try to provide wraparound services for children, what might it look like? And then the other part of their job was to say, as a clinician, what would I need to know? What supports would I need to actually do this? Now the advantage was these were very seasoned clinicians and they had the vision in mind. So I think, the process started there, and then from their insights, we developed sort of the outline of what we thought the core ingredients would be if you were going to provide services in a different way. That led to a demonstration project in which then we looked at, can we actually have OTs who are not researchers, who weren't part of the team, who don't have all of that? Could we actually see if we could get them to do this? And so it started the building blocks from there, but it starts with, I think, a core group of people who have a common vision and a common interest, and that's where you begin. And you identify the champions, you figure out, so you don't start by going out and saying, I want to change a whole system. You figure out, here is a speech-language pathology clinician who's really interested in improving practice and who really sees that, we need to do something different. You start with a principal who's really motivated to do better. You start with a healthcare agency who's like, we know we're not doing this right, we want to do it better. And so you identify who your local champions are, and then that gives you the drive to start, and that gives you people who are then going to go out and say, this is the greatest thing you've ever heard about. And in fact, when we did our demonstration project, we actually had a teacher who approached us at the end of the year and asked to make a video. And she said, I just had the most wonderful experience with this occupational therapist working in my classroom. I want to, and I was scared at first. I didn't know what it would mean to have an OT in my classroom. I didn't know what if it would be more work for me. I didn't know what she would want of me, if she could add something. And this experience turned out to be the best thing I have ever done. And I would like to tell every teacher out there who's ever going to hear about this program that if you hear about it and you have the chance to do it, you jump at it. And I can tell you that to this day, we show that video from that teacher at every presentation we do, and it is by far the most powerful thing we can do to get momentum. She's a champion.